Thanks for coming back for round two, everyone on the call. So today we have with us David Fern. He's the healthcare leader with over 20 years experience advancing digitally enabled integrated care across Ontario's primary care system. As an area manager at Ontario MD, he leads a regional team serving clinicians across Southern Ontario, guiding practices through digital tool adoption, workflow transformation, and sustainable change. So we're so happy to have the Ontario MD team with us today, and I will turn it over to them. Thank you so much.
Thanks very much, Shannon. I do appreciate the opportunity, and I thank all of you for joining us today. So first, I just want to do a bit of a disclosure. There are three presenters today. So Olivera Bosnick, she is a practice enhancement consultant with Ontario MD. Serge Rotondi, he's a practice advisor with Ontario MD. And my name's David Fern, and I'm an area manager. So all three of us are full-time employees of Ontario MD, and we've not received any direct financial or in-kind support for this presentation. So now that I've mentioned that, who is Ontario MD, just in case you're not familiar with us? We are a wholly owned subsidiary of the Ontario Medical Association. So we are not government per se. We style ourselves as trusted advisors to clinicians using technology to enhance patient care and to realize quality improvement goals. We're also a delivery partner for Ontario Health, and that is where the bulk of our funding comes from. So we are funded through what's called a transfer payment agreement with Ontario Health, and we deliver products and services on their behalf to physicians and clinicians across the province. We also manage the provincial EMR certification program. So if you're using an EMR in your practice, chances are it's been certified by our program. And that I'm not going to go into sort of the nuts and bolts of certification, but it basically allows your EMR to connect to certain provincial resources. So now that you know who we are, what are you going to learn today? So I'm going to talk a little bit about our advisors and our peer leader program. I'm going to talk about a privacy and security tool that we launched several years ago, but it's recently been updated. So I want to talk about some of the updates. I want to talk about the AI Scribe Vendor of Record, which is a program you might be familiar with. A little bit about our conferences and our education materials. Serge is then going to jump in, and he's going to talk about some of the technologies that you can connect to your EMRs. And then Olivera is going to talk about a practice facilitation model known as SEED. So hopefully this will be worth your while, and I'll jump into it now. So we've got practice advisors and practice enhancement consultants that live and work across the entire province, and by that I mean literally. So Windsor to Ottawa, Toronto, and we even have someone up in Thunder Bay. So they work in your neighborhoods and close to where you work, and their job is really to help you understand technology, how it works in your clinic, and how it can enhance patient care. We've got lots of education materials. They can teach you how to use toolbars, save tips, talk about workflow assessments, those sorts of things. And all of our services are free, complimentary, that is. So if you call us or you send a note to our intake team, they will route you to one of the advisors across the province, and they will work with you either in person or virtually to help you with whatever it is that you think that you need around digital health. We also have what's known as a peer leader program. So these are full-time practicing physicians, nurses, clinic managers that work for us on a contract basis. They are experts in digital health, and we can assign one of these people to you to help you, understand, from a clinician's perspective, how they're using their products in their clinic, and teach you some of the tips and tricks that they use on a regular basis. Again, this is another complimentary service that we offer, and I think it's one that is not as well known as some of the other things that we do. And I would really encourage you, if you haven't taken advantage of a peer leader in the past, to contact us and see if we can help you out. Generally speaking, we've got peer leaders that use most of the certified EMRs. Certainly, there are some EMRs that are represented more than others, and that's just sort of a factor of the way that the products are distributed across the province. But for the most part, they can help you learn more and use your EMR and the tools that connect to your EMR in a much better way. So I mentioned privacy and security earlier on. So increasingly, there's been a number of new digital health tools that have come on the market over the past couple of years, and these are beyond just the EMRs. Obviously, with the rise of artificial intelligence, you're seeing scribe tools, you're seeing inbox management tools, clinical decision support tools, and while these tools are certainly helpful, they need to be used in a way that maintains your legal and professional obligations to patient information. And so that's where privacy and security training comes in. So this particular training was developed by our general counsel and chief privacy officer. Her name is Ariane Siegel. And so we just launched, actually this week is a brand new 2026 update that just went live a couple of days ago. So there's 2 modules. And if you take these modules, you do get CME credits and a certificate of completion. So not just necessarily for the clinicians, but I would recommend that staff take this as well, because I think there's useful information in there for everybody. So the 2 modules are privacy and security foundations for the healthcare sector. And the second one is AI and digital tools, accountability, and cybersecurity. Where the AI module is concerned, we talk about the types of tools, consent requirements, privacy obligations, and cybersecurity tips. And we also discuss the IPC administrative monetary penalties and EHR consent directives. And so, as I said earlier on, this is good for you and your staff. Both community-based clinicians and hospital-based could benefit from this particular tool. It's just available on our website, and again, complimentary service from Ontario MD. So some of you are likely using an AI scribe tool in your office at this point in time. Just to give you a little bit of background of our involvement with AI scribes, a couple of years ago, about 2 years ago exactly, Ontario MD partnered with a number of other organizations, Amplify Care and Women's College, and we actually ran a study on AI scribes. So we let physicians and clinicians in the community use the tools, and then we asked them to give us feedback on how it worked. And so the results were extremely positive. So 70 to 90% reduction in time spent documenting, up to 4 hours per week on average saved time, and 75% felt there was significant improvement on their cognitive load during patient visits. So, all told, a really positive experience, and the results were quite dramatic. And so from that, Ontario MD, Supply Ontario, Ontario Health partnered to launch what's called the AI Scribe Vendor of Record. So you may have heard of this, you may not. What we did was we looked at compliance and legal requirements. We looked at a number of different regulatory items. We looked at contracts, and we put together a program such that vendors could apply to it. And these vendors, if they got the stamp of approval, if you will, there's a list now on Supply Ontario's website where you can go and you can be assured that the data is kept in Canada. The pricing that you get is as good as it's going to get. So it benefits from economies of scale. And again, the contracts themselves have been vetted by the appropriate people. So provincial people, our lawyers, OMA lawyers. So it sort of takes the burden off of you so that you can just use the tool without fear of, where's my data going? Is my patient data safe? Those sorts of questions that, quite frankly, you may not necessarily be qualified to answer. So we've taken that burden off of you as a clinician to allow you to do your work when you're seeing your patients. So from Ontario MD's perspective, we can help you with change management upfront and afterwards. Supply Ontario will be the organization that actually recommends the tool for you, and they have a questionnaire that you can fill out. Once you do that, they will recommend a number of different tools that you can contract with. And if you don't like the ones that they suggest, you can go back to them and they can suggest more. Um, so that's the vendor of record program. If you are interested in learning more about AI Scribe and just AI in general, Ontario MD has a standalone website called the OMD Practice Hub, and it's full of great information that I think that that you would really, benefit from. So you can compare and contrast digital health solutions, educational materials, and a whole bunch of other things that I think would be really useful, that are at your fingertips here. So a couple other educational items, and then I'll let Serge take over. So we have a number of community of practices. So there are 3 for EMR vendors, so QHR, TELUS, and Well Oscar. And then we've just launched an AI Scribe one as well. And so these are virtual, so you can attend them, from your office. And they bring together clinicians. They also bring together the vendors themselves, and Ontario MD peer leaders are on there as well. In fact, Olivera is actually the person at Ontario MD who sort of coordinates all of these COPs. So she might touch on these a little bit later, but I wanted to mention them because they are a valuable tool. And if you send an email to the email that you can see on the screen, you will get invitations to them. And last but not least, I wanted to mention our educational conferences. So we run 2 every year. So the first one is a virtual symposium, and that's coming up on April 24th. And then we have our main in-person conference, which is in October, which is going to be down at the Beanfield Center on the grounds of the exhibition. So again, you can earn continuing medical education credits for them. And I went to our marketing department and they've given me this code here. So if you use OMD 1500, you can get 15% off the virtual symposium that's coming up in April. And if you go to ontariomd.live, you can actually see the program and at least for the virtual symposium that's coming up at the end of April. So with that, I am going to pass it along to Serge, who's going to talk about some of the digital tools that are available.
Thanks, Dave. Yeah, so I'm just going to be spending some time discussing the specific products and services related to your EMR and your specific day-to-day workflows. So as we know, the EMR, it works best when it's integrated with the different provincial assets and healthcare facilities throughout the province. And examples of this are access to hospitals through HRM and OLIS, access to community-based physicians through eConsult, through home care, through telehome care. So that's kind of where we can help assist with being the conduit or gateway to access that patient data. Okay, next slide, Dave. So currently now there's already products and services that are available to help achieve this. Things like hospital reports and e-notifications, lab results through OLIS, DHDR, eConsult, eForms, and new coming through that some of you I know in this group already have it, but one of the newer ones is they call it Ontario Health Tools, also known as kind of contextual launch, but different products. It's almost like it's like an Ontario Health kind of portal. And different products now are going to be added to there. And through your EMR, you'll be able to access these different products through that portal. So currently now there's things like OTN eConsult there, Cancer Care Ontario reports, and Clinical Connect, which is one of the viewers. AI Scribes is a great tool now that's being integrated to more and more EMRs. So things that are coming up next in some of the roadmaps are things like the Digital Health Immunization Repository and other clinical viewers. And there's also talks of consolidating all the viewers into one, but that's more for future discussion. Next slide. So we know this is a lot of information for you and your clinics to work through to see what's best for you and what works best in your workflows. So next slide, Dave. So that's where Ontario Health can come in. We can work with you and be your trusted advisor to, first of all, educate you on what everything's available to you, like what all the products and services are available, and then maybe just work with you to see what best fits for your workflows and your needs. And just, we can take a look at your current setup and then just even whatever EMR you're using to really just kind of, tailor some products and services that best fits you and your group. Next slide. So there's two ways that we can do this. Is one through the products and services, and that's the OMD Connect side of the page there. That's things like I talked about, like HRM, OLIS, DHDR. And the other side is kind of what a few things like that Dave mentioned are things like our digital health events, which are great for information gathering and to learn how other people do things and new things that are coming down the pipeline. The privacy and security courses, like Dave mentioned, which is great for everyone on your staff. Kind of what Oliveira is going to be talking about a little bit in the next few slides is the OMD advisory service, which can help you out with QI internal projects, with your CPSO projects, also just with tips, tools, templates to help you with your day-to-day workflows and processes. And then also, like, as Dave mentioned, our peer leaders, which are a great resource. They can do one-on-one training or group training for you and your team, and they can work on, just give you best practices, kind of let you know how they do things to see if that works with what we're doing, or even if you have specific questions regarding EMR and how certain things should be done, and maybe even a little more on the clinical side, they can help out with that. So now we're going to just start diving a little more into the specific products and services. So we do have a couple of products that are our own that were developed by Ontario MD, like Health Report Manager, our certification program, and our EMR lab that we can do our own testing with. But we partner with primarily Ontario Health regarding other products and services that we do offer and deploy on their behalf. So the things like DHGR, eForms, e-notifications, OLIS, OneID, and eConsult, those are partnered products with Ontario Health. Next slide. So we'll start off with OneID. So what OneID is, it gives you access through authentication, secure authentication into Ontario Health or other provincial assets. You can self-register for that as a physician via the CPSO website. If not, you can either contact Ontario Health Support or you can contact me directly. My contact information will be on the last slide, so you can feel free to reach out regarding this or anything else in the presentation. Next slide. So OLIS is Ontario Lab Information System. So this is where lab results from all hospital labs, all community-based labs, and public health all get deposited into. And from your EMR, from the patient chart, you can simply do a query within a certain time frame, and it'll download all the lab results from within that time frame. And it can download right into your EMR, and you have quick access to it directly. Next slide. So DHDR is the Digital Health Drug Repository. And this is a relatively newer integration, especially with our TELUS clients in the room. So what DHDR is, or Digital Health Drug Repository, is a viewer that allows you to view all your patients' medications in the provincial repository. The medications that are listed there are dispensed monitored drugs, things like narcotics, opioids, and any other controlled substances. All publicly funded medications, so things like that are part of OHIP Plus, or if you're a senior or any ODP or Trillium program, will be listed there. COVID-19 vaccination reports will be listed there, and also any funded medication, pharmacy services will be also listed there. This is a viewer, but a really great part of it is that you can actually pull up side by side what medications you have in your EMR compared to what's in the viewer. So you can do a little bit of validation. So if there's anything missing, you can add it to your EMR and make sure it's up to date and accurate. And it's also great if you have new patients coming in, you want to take a look at what they have currently prescribed to them. Sorry, next slide, Dave. Thanks. So e-forms is what these are. They're electronic forms right within your EMR. Currently, there's 16 Ministry of Transportation forms that are there. When you pop it up or pop it open, what will happen is the patient data will get automatically populated. You'd simply enter the information you needed to enter, and you can submit it directly from within your EMR. So no more printing off and faxing. It could all be done electronically right through your EMR. This isn't available in all the EMRs. The EMRs there are listed at the bottom. So Acuro, Averos, EMR Advantage, Yes, and YMS. We'll see what happens in the future with the other EMRs, but currently right now, those are the ones that have this available. Next one. So Health Report Manager and e-notifications. I'll kind of describe what they both are. So Health Report Manager is any medical record report or diagnostic imaging from a hospital. And the diagnostic imaging report is simply the radiologist's actual consult note that will get sent out from the hospital into your EMR inbox. Once it's in the inbox, it will get matched to a specific patient and will get categorized by the report type. Some hospitals do list off the report types better than others, but we, as part of HRM, we do actually carry that into the EMR as well. It doesn't just come from hospitals. A lot of specialty clinics, things like independent health facilities, cardiology clinics, X-ray clinics, ultrasound clinics, they'll send the reports via HRM as well, directly into your inbox. And e-notifications is a specific report type that is connected to the ADT system in the hospitals. So if one of your patients gets admitted into emergency or admitted or discharged from inpatient, it'll get sent directly from the ADT system directly into your inbox. Most EMRs are set to pull for every 30 minutes, so it's a very quick transfer of information from the hospital or independent clinic directly into your EMR. It can be as quick as 30 minutes. And so this has been a product of ours now for over 10 years. Millions of reports are getting transferred, and it's just a great tool that, but we know that there are some challenges, and that's why we do have an advisory committee. And I believe last year they came up with it's HRM preference management. And specifically for right now for e-notifications, there are many physicians that thought there was a little bit of information overload, and they thought just for their basic workflow, they didn't need to have that information in their inbox. So as part of that HRM preference management, we gave the physicians the ability to opt out of those specific report types. So currently right now it's just e-notifications, but in the future we'll see if others are added. But that's the kind of ongoing quality improvements we want to make to the product. And there are other ones coming as well. I know that they're looking at AI to see if there's any kind of assistance they can offer into the inbox management using AI. So there are ways that we're always looking to improve. And yeah, so I know that there will be some better improvements to just regarding the feedback that we're getting from our advisory committee. Next slide, Dave. So eConsult is a tool where a family physician or nurse practitioner can reach out and ask a question to a specialist, especially if they don't believe that the patient really needs to be transferred or seen by the specialist. So they may have a question regarding medication or just if it's a dermatology type of question, they can simply take a picture of the rash or scar, whatever the case may be, send it directly to a specialist. They can review it, and then they can determine whether the patient needs to be seen by them, or they can just give you a plan of what can be done to help that out without that patient having to be seen, and the wait times and everything else. So it's a great service, and that communication channel between community-based care and specialists. So right now it's integrated with a couple of the EMRs, but the EMRs that it's not connected with, as part of that contextual launch, Ontario portal type of thing that we were talking about before, there's access to OTN Hub from within there. So from within your EMR, you can still get in, access to OTN Hub, and then and then do your e-consult. When the result comes back, it is now integrated through HRM. So if you want to have the results of whatever the specialist sent you into the patient chart, you can actually send it via HRM. There's simply a button in the OTN webpage where you can simply click send a PDF and send to HRM, and it'll send it directly back into your inbox, and then it'll go into the patient matching, and it'll be right into the patient chart. Next slide, Dave. So now I'll pass it off to Olivera. But like I mentioned, I'm the practice advisor for the area. So if you have any questions regarding any of those products or services or any other thing you want to discuss, feel free to reach out to me. My name will be on the last page and contact information. So I'm always available to assist. Thanks.
Thank you, Sergio. We could just move on to the next slide, Dave. Thank you. Yeah, so I'm Olivera Bosnick, and I'm a practice enhancement consultant at Ontario MD. So in my role as a practice enhancement consultant, we provide tailored approach. We've worked with medical practices, several clinics across the province, and there's 7 of us across the province. Like Dave had mentioned earlier, from Ottawa to Niagara-on-the-Lake, or Welland, I think it was. Yeah, so we provide support to intermediate or advanced EMR users searching for ways to improve efficiency of their EMR. So sometimes this could include some hands-on coaching and support, one-on-one training. As well, in my role, we also help clinicians achieve their QI goals and population health priorities through CPSO QI, or just if they're working in a clinic that's working on a QI initiative. We provide education, training, tools, and other supports to the clinics. The OMD Advisory Services PEC team leverages the model for improvement for all of our QI initiatives. Many of you probably have heard about this already. It's a framework, and it's one of the most popular QI models used in healthcare settings today. If we could just go to the next slide. Dave and Sergio both touched on OMD Educates already. Basically, it's a great site. I put the link at the bottom, OMDeducates.com. So you'll learn about our digital health events. That's where you can access the online privacy and security courses, support to achieve your QI goals, and other EMR tools, tips, templates, searches, queries, lots of information there. We can go to the next slide. Thank you. So now we're going to get into the SEED. SEED was developed with collaboration with Ontario MD and the Ontario Medical Association and Dr. Rebecca Lubitz, who's also an Ontario MD peer leader. You can go to the next slide. So why and how does the SEED framework exist? The goal of SEED framework and practice facilitation model is to provide a clear lens that practices can use to reduce administrative burden. This approach was developed by a practicing family doctor, Dr. Rebecca Lubitz, who is dealing with the same pressures many of you are. She first presented the SEED approach to reducing admin burden at one of the Ontario MD digital health conferences, where it resonated strongly with clinicians. And since then, we've been working to further develop and expand this approach. Dr. Lubitz found that even with AI scribes in place, the core issues hadn't changed. Documentation during visits improved, but the volume of results, reports, alerts, and paperwork continued to grow. There was simply too much flowing to one person. So SEED was born out of that frustration and out of the realization that no physician, no matter how efficient, can safely manage an unlimited inflow of information. The framework was created to change the conditions around the physician rather than asking the physician to absorb more information. So that's the why behind SEED and where it came from and the problem it was designed to address. If we can go to the next slide. Just give me 1 second. So what is SEED? SEED is a practical framework for managing administrative and inbox workload. It's not a checklist or a prescription, it's a lens. The lens will help teams or individuals in any areas of a practice ask 3 basic questions. Does this task need to happen at all? Who actually needs to do it? And where should it live in the workflow? Let's talk about STOP. It's all about prevention. if something doesn't require physician judgment, it shouldn't arrive in the physician inbox. Examples of this are sick notes, massage notes, chiro, orthotic requests, and other patient requests. This usually comes down to clear rules and agreed upon protocols within your clinic. Eliminate is about removing noise. So Dave and Sergio both mentioned this: duplicates, HRM reports, paper copies, and low value notifications. So partial labs, hospital labs, HRME notification, this all can be eliminated. And this is often where the teams see the biggest immediate reduction in volume. Educate. Educate is about building shared understanding of urgency and clinical value with your staff. It's not a one-time training, it's ongoing clarity so staff can act confidently and consistently. And the last part of the SEED framework is delegate. It's deliberate and it's safe. It's supported by protocols and medical directives, and it actually reduces risk by making work predictable instead of ad hoc. So educating and delegating often go hand in hand. So SEED gives teams a structured way to decide what can change rather than relying on individual workarounds or adding more tools up on top of an already full system. And we'll dive into a few examples in a few minutes, but I just wanted to talk about the benefits for everyone. So starting with staff, when people are educated and trusted to do work that's appropriate for their role, they're more engaged. Delegation is about offloading all the work. It's about enabling more meaningful work and creating clarity around responsibility. What she consistently saw is that when staff understood why they're doing something and had clear protocols to support them, confidence went up and frustration went down. At the clinic level, this translates to a healthier work culture and better staff retention. Teams function more smoothly when work is predictable rather than reactive. From a resource perspective, facilitation helps clinics get more value from the staff that they already have, not by pushing people harder, but by aligning work with the skill and role. In a system with finite resources, that kind of alignment really matters. And for the physicians, the goal is simple but significant: fewer, low value items in the inbox, less cognitive load, and more protected attention for work that truly requires physician judgment. Delegating appropriately reduces burnout, improves work-life balance, and creates more space, whether that's for patients, teaching, leadership, or life outside your clinic. We can go to the next slide. Okay, so we're first with the approach, we like to start with eliminate first, because it's like a low-hanging fruit. There are many ways you can leverage the EMR to bring those ideas into day-to-day practice. Sergio and Dave touched on this already, but I have a few slides here and you'll see a QR code. So stop paper from HRM. Some people are still receiving paper copies of reports via HRM. So if you go to this QR code, it brings you to their website and it brings you to the sending facilities page. When you click on that green plus sign, I know it's very faint on this slide, but you can see it, it'll let you know in that sending facility that you're selecting who, can you stop paper? Yes or no? In some cases, I have an example there, a clinic or a sending facility that does not stop paper, but then I put in yours, like Ridge Health, the closest one to you. And it gives you the name of the person, not the name of the person, sorry. Sometimes it gives you the name of the person, but in this case, it's just the email address of the person on who to contact to stop paper. It's a really important first step. Also, Dr. Lubitz had provided us with a template that she had used at her clinic when her staff reached out to those sending facilities. And now we have also added that on our website, and that's where it says how to stop paper fax reports. You don't have to use this template, but it's a great guide, so we thought we'd share it. If we can go to the next slide. Eliminate also opting out of receiving e-notifications. Sergio talked about this already. I don't have to go over it again, but there's another QR code. If you go in there, it brings you right to that form to opt out of those hospital discharge summaries. And then life labs. I want to talk to you about requests for final labs only. So a lot of clinicians are getting bombarded with all these partial reports coming in. Definitely, it is an option at Life Labs. If you go to that QR code, it brings you to the form that you use to fill it out, and it's per clinician. So one person can't fill it out for 10 doctors each. They'll have to do it 10 times. Basically, they go in and they can opt out of receiving partials and they only receive finals. They do have safety in place. So, for example, if it's a critical test, it'll come in regardless if it's a partial or not. And also, if there's some tests that remain outstanding and it's been more than 48 hours, they'll automatically send the partials before the final. Dynacare, I'm not sure what labs you use or what are you used most frequently in your area, but Dynacare does not have this option at this time. But if you reach out to them and kind of put in a support request ticket, they said that they would kind of look at that and see how many requests they get, and they might actually incorporate that feature in the near future, but I can't promise you that. If we can go to the next slide. So let's talk a little bit about stop examples. So these are items that need to be in the EMR but can stop flowing to the most responsible provider. I mentioned this earlier: massage notes, orthotics, physio, school vaccination requests. Sometimes Dr. Lubitz had mentioned in her presentations that if they're sending a patient for like a CT scan, sometimes they need an update creatinine for the patient. So Dr. Lubitz will never say no to that. It's an example of she created a protocol where her staff can go and just generate that requisition, send it to the patient. They'll get their creatinine level in a timely manner. Okay. Referral redirects can be a little more challenging, but it does take out a lot of time out of a physician. So those redirects, I'm missing paperwork or missing lab reports, or I'm not accepting this patient now, find somebody else. So if you develop a protocol to allow your staff to redirect these until it's accepted, unless it's urgent, you can definitely do that. So really focus on that. You don't want to critical referrals, have your staff manage those. That might be something that has to come to you. And then the school-aged children vaccine records, the yellow immunization card. If we all have kids at some point, maybe that, you get that call or that email from the school board saying your child will be suspended. So, I'm frantically calling my doctor's office. So basically it stops at the front desk. It doesn't go to the physician. They find the information. They print it, they provide it to the patient, or they email it to the patient. And in some cases, it may lead into an patient appointment, and doctor doesn't need to handle it until the patient is in front of them in their office. So if we go to the next slide, this is a really busy slide, okay? But I find it really impactful because Dr. Lubitz was kind enough to give us some of her templates and her protocols that she has in place. Protocols are really important. It allows you to have clear rules and processes in place. This is an Excel document. So what she suggested is best place to start is with reception. Start with things for which you would never say no to: creatinine for your CT scans, massage, physio notes, vaccine requests. Then consider nursing protocols. If you have nursing in your office, what is something that they can do that doesn't have to go to the physician? Okay, so in this example, you'll see I'm going to focus in a little bit on the spreadsheet. She's got it in a few different categories. So task is like, what are they talking about? So facility, I'm going to go to the patient's vaccine record because it's the simplest one. In her clinic, the workflow you are in basically means like, how do you get these requests? So it comes in through a phone call, and they actually have a website where the patients can click on a form, and it kind of sends a message to the clinic that they're requesting this information. So that's just why she has phones or web forms in there. And the explanation column is basically like the steps to outline what the staff needs to do. And then the colorful side of this slide here, the AA all the way to GG. These are the doctor's initials. So you'll notice that there's some green and red. Green means go. Like, yes, this doctor's agreed that, you can do this for me, staff. But then there's some physicians that say no. If it's something like a creatinine for a CT, Dr. BB is stop. I'm not going to I'd rather that come to me. So having that in place, having this spreadsheet in your clinic is really important. All right, let's go to the next slide. So this is just examples. Depending on what EMR you use, you can use macros if you're using a Curo to create these letters. You can have stamps in PS Suite that has the information pre-filled. So it saves time for the staff. And then in Oscar, if you're using Oscar EMR, there's templates that you can use to create those letters. If we just go to the next slide. Great. So now we're going to talk about educate and delegate. This is the hardest and most time-sensitive step, but will save you the most time in the end. Turnover in primary care staffing is very high. This helps mitigate that by providing meaningful work and opportunity for advancement. Delegate to reduce physician workload and burnout. That's why you're delegating. It's a win for staff. It's more meaningful. It's a win for your clinic. Better retention, more advanced staff equals less staff equals cost savings. And it's a win for the clinician, better work-life balance and focus on higher level things. You can go to the next slide, please. Thank you. So delegation, but start by understanding the scope of practice for each member of your team. Delegation means authorizing someone to perform a controlled acts that may follow outside of their usual role, but only when they have the appropriate training and competence to do so safely. So I strongly encourage you to go to the CPSO policy delegation of controlled acts, review that. And if there's another QR code, because I love QR codes. If you go to this QR code, OMA does offer a delegation checklist that you can use as well. We can go to the next slide. I wanted to provide you some examples of things that we did with Dr. Lubitz. So this looks like a really busy slide. I'm not sure who's using PS on this call, but you'll see that on the right side of your screen, you've got like really busy requisition. So Dr. Lubitz was kind enough to share that with us. The top right corner of that requisition is buttons that she created. So these are different, like, for example, if you clicked on diabetes long, it would automatically put in the check marks of, a diabetes visit or a diabetes short visit, because some doctors have different requests for labs based on, 3-month or 1-year intervals, osteoporosis, prenatal, whatever the case may be. You'll see those buttons there. And on the bottom, so if the staff is doing this for you, you're going to have to insert the doctor's signature. So if I have at the bottom, you'll see Marilyn and Mickey because it's Mickey Mouse. It's a, demo data. We didn't want to use Dr. Lubitz's doctors in there, but it depends on how many staff you have at the clinic or how many physicians you have in the clinic. You can definitely go in and click it. It puts in Marilyn's signature. And then on the left side is just a sample of a super form where it's got the requisition and then like a True North imaging requisition with it. We go to the next slide. I wanted to show you a little bit about Accuro because somebody here might be using Accuro and Oscar, and they kind of work in the same way where it's like a managed security setting where you can delegate the requisition form. In Accuro, again, top corner, lab rec diabetes. They don't have buttons, but you can definitely take a blank lab rec, duplicate it, pre-select what you want and save it as lab rec diabetes, so it's a little easier to access. And rather than having buttons, if you have the permissions, when you click on the provider list on the right side, you would just pick the provider this requisition is for, and then it would insert their signature automatically. We go to the next slide. This one again is a Accuro example of a super form. So this is something that Dr. Lubitz talks about as well, is like sometimes physicians are sitting there, especially with prenatal visits. I've got like 17 different forms. Okay, that's exaggeration. Maybe like 3 or 4 different forms when the patient comes in and says, I'm pregnant. So this is just a super form that is created in Accuro that we did with another physician where it's got your lab rec pre-filled. This doctor was North York General, so like some other prenatal screening requisition, and then your last form that checks for STDs. Next slide. Inbox management is really important. All 3 EMRs work a little bit differently. For PSS, it's you need to kind of go into your edit user coverage. So just wanted to kind of show you how to do that. For Accuro and Oscar, for those of you that are using those EMRs in the call, it's a little bit simpler. It's just something under managed security that they'll have access to other physicians' inboxes. And this would be helpful for nurses. So even having nurses look at your inbox and just maybe kind of review the normals so you don't have to is something that doctors might do in place, and that would have to be a protocol because you may not want them to review all the types of lab tests that come back, but some. If we go to the last slide here, basically in summary, SEED encourages a more intentional approach to managing your EMR inbox by stopping unnecessary work and eliminating non-essential items. It's also about empowering your team, educating your staff to recognize clinical priorities and delegating tasks appropriately with clear protocols. By doing this, you can better leverage your EMR to improve efficiency and reduce inbox burden. And thank you is the next slide. And that's it. That's all I had for you today. Thanks, Dave.
Thanks, Olivera, and Serge, of course, too. So that ends the formal presentation. I don't know, Shannon, if we've got time for questions, but we're happy to entertain those if anybody has any.
Yeah, absolutely. Lots of time.
There
There was
was
just a comment in the chat about QR codes, David. So I don't know if you want to maybe send out some links for those QR
Yeah,
codes that were
sure.
in the presentation.
Yeah, maybe we'll
I'll-
just send them to you, Shannon, and maybe you
Sure,
can
of course.
forward them to the, yeah, okay.
Absolutely. It's great. Perfect. I think this is a great presentation. Lots of helpful information. I think, you know, sometimes overwhelmingly helpful information. You don't know where to start, but I would just suggest the first place to start is maybe a call to Surge and see what could be tailored to support your clinics and your specific needs. But any questions from the group?
Yeah, so I would just echo that, Shannon. I mean, a lot of these things take time, and so it's best to talk to Surge as your initial contact. But if I'm sure you could forward you on to Oliveira or whomever else that covers the region from a practice enhancement consultant perspective. But yeah, Surge is your go-to. Dr. Kennedy has a question, it looks like.
Yeah, thanks, Dave, and everyone. My question is, you know, because we have a lot of users using, you know, Accuro, Oscar, and PS Suite, do you have a database of these documents to make it easy that they can share instead of having to create their own PDFs for referral forms? Or does that have to be done individually?
I don't know if Oliveira, you have an answer to that one.
You mean like referral forms, like you mean like the prenatal bundle forms that I showed you?
Yeah, so a combination of things.
Okay.
So one, yeah, the bundles, but also, as you know, everyone has to create the forms to make them work and integrate into their EMR suites. I didn't know if you guys had templates. So like when new physicians start,
Yeah.
one of the challenges they have is having everything bundled to their EMR. And so just looking to see how we can support new starts and improve current users.
Yeah, so where I would first start is probably on OntarioOMDeducates.com. I keep calling it OntarioOMDeducates.com, but it's OMDeducates.com. There's a plethora of resources on there, and you can look at your EMR tools, and you can see in there what's available. And definitely, if you reach out to support at OntarioMD.com, I've worked with clinicians in that position as well, where they're kind of new to a practice or new to a team, and they're just like, oh, you know, can you help us kind of enhance and improve and what, you know, not necessarily improve, but like, I don't know what I don't know. So yeah, we don't have those templates like on a website where you can just download them automatically. It'd be more of like a one-on-one discussion and get a sense of what they're looking for and then help them develop those.
Yeah,
that
we
make
could
sense?
also probably put you in touch with a peer leader who uses the same
Yes.
EMR as yours, and they would be able to likely share them with you. So
That's actually a really good idea, Dave. I would probably even start with that after my initial conversation too, is like start with the peer leader and then
So we did that.
sometimes.
Yeah.
Oh, you did?
Yeah.
Okay. Okay.
Yeah.
Can I ask a question as well? So I saw the recent announcement from the provincial government about a provincial EMR. So
yes.
just wondering, you know, does this group have any inside scoop? What does that mean for primary care? How can folks prepare for that? And is it should they be investing still lots of time and effort in developing their current EMRs? Like what's coming and how should people react maybe to that announcement?
Yeah, so certainly interesting announcement last week. I'll be perfectly honest with you. I don't have a lot of information other than what's in the announcement itself. In fact, nobody has a lot of information at this point. There's more questions than answers at this point, so I don't have anything good to tell you other than I've been advised to just ask people to contact the ministry directly with questions and about that. I mean, certainly there's a lot of chatter. If you go look on LinkedIn and other places, there's a lot of people talking about it. And we had a company-wide meeting the other day, and even our CEO didn't have a lot of information to provide. So yeah, it'll be interesting to see where this discussion goes and what the province is is going to do, and Dr. Philpott and her ideas with the PCAT team. So we'll just have to see. So I don't have a great answer for you, Shannon. Sorry, I knew that question was going to come up today, but yeah.
Sorry to be the one to ask it, but
No, it's okay for
I think
sure.
it's
Yeah,
on
I
everyone's
wish
minds.
I only wish I knew more. I'll be perfectly honest with you. So,
Yeah.
Yeah.
For sure. And those announcements are often what I call a little bit of a nothing burger. They give you a little taste, but there's not a lot of substance. So we'll wait to see how it all plays out. And
certainly, our instructions is business as usual. So that's what we've been asked to do going forward. So
perfect. Okay. Sounds great. And we all know that nothing moves very fast in healthcare. So we
That
can
is,
probably anticipate a long runway with lots of information ahead of time. It's
yeah,
not
that's
changing
like
tomorrow.
a golden rule almost. So yeah.
Absolutely. Okay, well, thank you so much to the OMD team. Fantastic to have you here. I'm just going to throw up one more slide before we leave for the day. So again, thanks to everyone for joining. I will also in the chat put our evaluation form. So if you could just take a few minutes to do that. Certificates of attendance will be emailed to you sometime next week. And please join us next session, which is the last Friday of April. So we're doing these the last Friday of the month. So April 24th, and we're going to have a few talks again on minimizing provider burnout while maximizing preventative screening, and then building on your medical team practice management tips for extending your clinical reach, as well as some more details on the Scope Nurse Navigator and how she can be part of your team here in Durham Region. So excited to see you all then, and have yourselves a great weekend, a great afternoon, and thank you so much again to the Ontario MD team.
Thank you very much. Have a nice day.
Thanks. Take care, everyone.